Hello, I'm Dr Beth Colby from Talk Mental Health. I'm a psychiatrist in London. So the anxiety disorders, I'm going to talk about agoraphobia, social phobia and panic disorder, generalised anxiety disorder, obsessive compulsive disorder and post-traumatic stress disorder. First of all, what's anxiety? Well, anxiety is a symptom, not a diagnosis. People have physical symptoms and psychological symptoms. Very uncomfortable feeling, may have fast heart rate, palpitations, may breathe fast, hyperventilate, leading to tingling in their hands, feet and mouth. They may have stomach pains, indigestion, muscle pains, headache. They may have problems sleeping, urinate more frequently, have diarrhea. There's a whole heap of symptoms. And with the psychological symptoms, fear, worry, impending doom, thinking people might be looking at them in a negative way, don't like them, or they've upset somebody, things like that. So that's the physical and psychological symptoms of anxiety itself. Now, in the anxiety disorders, with agoraphobia, people feel anxious in closed spaces and also in open spaces, busy places. So it could be in a shopping mall, it could be on a bus. And people, they feel anxious, and then this may lead to them avoiding these situations and staying at home. It's a very debilitating condition, and people feel anxious each time they, may need to get out of the house or want to get out of the house, but they feel so dreadful they stay in the house. Social phobia is where people feel really anxious in sort of small social groups. So if they don't know what to say, they may feel embarrassed, feel as though people are looking at them and know they're anxious, worried that they may upset somebody or have offended somebody, worried that they may embarrass themselves. So they then may go on to avoiding these situations to try not to feel anxious. So then panic disorder, this is where people feel panicky and anxious in certain situations and have what we call panic attacks, which are episodes of severe anxiety, maybe lasting a few minutes. People are worried that they may have a heart attack or faint to the floor. Their heart's racing really fast, and they've got to exit that situation as soon as they can and then avoid that situation because of fear that they may get a panic attack again. So if it happens on a bus, then they may avoid going on buses. If it happens in a shop, they may avoid going to the shops. So it's similar to agoraphobia in that people feel anxious in that situation, but they feel so panicky they've got to exit it really quickly, and they've got real fear and worry that this will happen again. They think they're going to die even. Okay, going on to generalised anxiety disorder. So this is where people feel anxious, but not in a particular situation, not at a particular time, but all the time really. So that's why it's called generalised. And anxiety is very severe in this. People find it hard to get to work, to carry on their normal lives. Going on to obsessive compulsive disorder. What's an obsession? What's a compulsion? Well, an obsession is a recurrent thought in people's mind. So the thought may be, oh, my hands are dirty, or I'm dirty, I've got germs, I've got to wash my hands a lot to get rid of these germs, otherwise I may get ill, or my family may get ill. And these thoughts are unwanted, they keep going in people's head, so they feel compelled, so that's the compulsive bit, they feel they've got to do that thing to stop them feeling anxious. So if people have the thought going through their head of, I've got germs, they feel as though they've got to wash their hands. And the anxiety may go a bit, but then the thought comes again, well, what if I haven't washed them properly? I've got to wash them again. And this carries on and carries on. So people may eventually have their hands be red and raw because they're washing their hands all the time. But because the thought's going through their head all the time, and they know that it's silly in a way, but the thought is just so persistent and unwanted that they've got to do something to stop having that thought and to relieve the anxiety, so that leads to hand washing. Other ones are also of people's health and safety, so people may have obsessions about that they may have left the gas cooker on, so they'll go home or keep checking that the gas is off. They're relieved when they find that it is, but then the thought comes again, oh well, what if I didn't check properly, and they've got to do it again. Or likewise with, did I lock the door? Am my family going to be safe at night because I haven't locked the door, so may burglars come? So they're up and down looking that the door is being checked. Or if they go out of the house, they may keep coming back or checking their car that it's been locked. The last anxiety disorder I'm going to talk about is post-traumatic stress disorder, or PTSD. Well, what's that? Post means after. Traumatic is a trauma, a really life-threatening or really, really awful thing happening, which could be like being sexually abused or molested. It could be having seen something dreadful, like Manchester bombing or the London Bridge attack. It could be having been in a car crash and been worried for your life, or it could have been being in the battlefield and horrible things happening there. So when people have post-traumatic stress disorder, they get what we call flashbacks and also nightmares. So flashbacks are where people experience that really awful thing that they've gone through again. So they're in their normal everyday lives, suddenly they'll get a flashback, and they're then and there, in that moment in time, they're in that situation again, and they are reliving everything they saw and everything that they experienced and all that anxiety that they had, and they're really, really horrible. And then also may have nightmares about it. Right, okay, so we've talked about terminology in common mental health conditions, and I've talked about neurotic disorders, where I've talked about different anxiety disorders. Remember to like, subscribe, and make a comment or suggestion. Thank you very much. It's Dr Beth Colby from Talk Mental Health. Bye-bye.